Here's a case example of an ACL injury with complete tearing of the ACL as well as lateral and medial meniscus tears. The ACL injury event involves a pivot shift of the knee. The injury can involve contact or non-contact, and surprisingly, the majority occur with non-contact, running, cutting maneuvers. The thigh bone and the leg bone in the pivot shift event rotate in different directions, and the ACL is injured. Many times, depending upon the energy at the time of the injury, there can be a spectrum of injury that occurs. You can have isolated tears of the ACL. You can have partial tears of the ACL. On the other side of the energy spectrum, when there's more energy, you can have complete tears of the ACL, two meniscus tears, and cartilage injury. A not uncommon scenario is to have an ACL injury with two meniscus tears, one tear posteriorly of the lateral meniscus and one tear posteriorly of the medial meniscus. When ACLs occur, the story is similar. There are twisting injuries. Patients and athletes often report a pop and a fall, and they're typically unable to continue playing that same day. The knee swells, and after the knee swelling resolves and normal life is resumed, athletes often report feelings of instability or giving way. With diagnosis, 80% is history, so discussing with the patient and hearing their story is the key first step. Our patient here is an 18-year-old high school wrestler who had his foot planted and he was continually driven by his opponent and felt a pop in his knee. On physical exam, he had a grade 2 Lockman with a loose endpoint, and his knee was locked at 15 degrees. He could not fully extend it. X-rays showed a neutral mechanical axis and a posterior tibial slope of 11 degrees, which is important just to understand what risk factors they had for their injury event. MRIs fill in the details and show us the full nature of the injury. On this MRI, you can see a portion of his lateral meniscus. The entire posterior horn has flipped forward and the root has detached. He also, on different views, had a medial meniscus posterior tear. Our first view inside the knee joint, we can see the completely torn ACL with a big portion of it flipped forward. None of his ACL was intact and 90% had flipped forward, blocking his full extension. Additionally, the component of the lateral meniscus that had flipped forward was also blocking full extension. Our first order of business is to remove the ACL stump and prepare for a notchplasty, and then we first address the lateral meniscus, reducing the flipped portion back into its normal location and then securing it with suture anchors. When we get the lateral meniscus flipped back into its normal position, you can see where it had flipped over upon itself and it had completely torn posteriorly. The medial meniscus alternatively had a longitudinal tear at the posterior horn. On the right side of the screen, you can see us probing that medial meniscus. We repaired both meniscuses with all inside meniscus repair constructs. And then for our reconstruction, we create a socket in the femur and then a tunnel through the tibia, and we pull our graft through the tibial tunnel across the joint. The patellar plug goes into the femoral socket, and then we secure the graft, making sure that we're happy with the full appropriate tension, and then making sure that we have full graft impingement. For major meniscus repairs, and typically for even isolated ACL reconstructions, based upon clinical studies, 9 months is the time where we look to return athletes to sport. Earlier time points can be associated with re-injury rates that are higher. Our first phase of the rehabilitation involves regaining full motion and normal life function. However, we protect these types of major repairs as toe touch weight bearing for the first 6 weeks and then a 2-week crutch weaning protocol, limiting range of motions from 0 to 90 degrees for the first 3 weeks. Phase 2 is about rehabilitating full strength and neuromuscular function, which is typically weeks 7 through 7.5 months. And Phase 3 is returning agility and sport-specific function, and is 7.5 months through 9 months. For more about why our timeline is where it is at this point, see our blog on when is an athlete ready for returning to contact sports after ACL surgery.